Cigna is celebrating 30 years of being a listed company, and over those 30 years, a lot of changes have taken place. Of course, most recently, we have the healthcare mandate taking effect. Now, I am here with the CEO, David Cordani of Cigna. Recently, the company also mentioned that you were going to have some layoffs. So is that part of this mandate that you can't spend as much on administration, or is this more right sizing?
It's a little bit of right sizing, but it's more getting the right skills in place. So over the last 3 years, we've grown our company by about 50% from a revenue standpoint and about 17% for employees. And looking into 2013, we had the opportunity to right size some of our businesses in Europe, in Turkey, as well as back here in the US. But we're additionally hiring people and investing on a go-forward basis. So we're continuing to grow and grow very successfully.
All right, because I know some people wanted to say, oh, they're laying off and it has to do with the healthcare mandate, here's the effect immediately. But I did see that you did have jobs open.
Yeah, we absolutely do. So we continue to add a lot of positions in health services, nutritionists, health coaches, behavioral and lifestyle coaches. It's actually the largest part of our business in terms of helping employers and individuals improve health, improve productivity, and improve wellness. Additionally, we're adding a lot of technologists because information is really the fuel that drives our business. So we're a net employment grower. This is going through a little right sizing from a skill set standpoint.
One of the parts of the mandate is that there will be a healthcare exchange, and I know Cigna is going to be a part of this healthcare exchange program. How do you see fitting into that?
Sure, the exchanges, which there's still regulation unfolding, but our expectation is that we'll play in the exchanges here in the United States in our chosen go deep markets. So our strategy has us focusing on specific markets and geographies where we have a really great value proposition for our customers. We'll focus there. We'll modify some of those products to orient around the individual market, and then we'll focus on some buying segments. So really focused on individual needs, specific buying segments in specific markets, and we think we're gonna have some great growth opportunity around that as well in 2014 and beyond.
So when people are looking at this chart and they're looking at you, they're looking at the competitors, you feel like you'll have, I don't know, like a Cigna Light, like a lower price product that people can choose if they really just don't make much money?
Well, it's not necessarily a product for people who don't make much money. It's a matter of getting the right coverage for the right individual. So we've been able to innovate in the U.S., and the U.S. employment market and healthcare market's been flat over the last 3 years, yet we've actually grown our revenue and our customer base every year. We've grown by focusing on customers and then designing the solutions, to your point, the products that meet an individual's needs, whether it's getting the right prevention and wellness, catastrophic cover, the right access to physicians. Additionally, what's been key to us is we have a lot of partnerships with physicians around the U.S. So by partnering with physicians, you're able to get a better cost outcome, a better service outcome, but there's trade-offs for individuals. So focusing on the individual, innovating products, and making sure you get the right price point and value for them has been key and will be key in the exchanges.
All right, well, it does sound like a very simple method to go about keeping the business run well, and I have to disclose that Cigna is the provider for TheStreet.com's employees, and I'm Deborah Borchardt reporting for The Street.